I am originally from Lutcher, Louisiana. I lived there till about 10, and then my family moved to Baton Rouge. And I went to college at LSU. I majored in biological engineering, and then got into med school, went to med school in Shreveport, did my residency in urology in Shreveport, and have been at the Baton Rouge Clinic for the last 10 years. So I'm married. My husband's name is Jess. We have 2 beautiful sons. My whole family is very talkative, so if you come to our house, you're gonna hear a lot of voices. So when I moved to Baton Rouge from Shreveport and I started my first job, I had no kids and no hobbies. Residency was pretty busy. And so for Christmas, my husband got me a beer brewing kit. And so I just started, I brewed lots of different types of beer. It's a great hobby to do while you're watching football in the fall. I usually do it outside on like a burner. And so, after several years of doing that, I kind of perfected my 2 signature recipes. We usually try to bring a pressurized growler full of about 10 beers to whatever parties we get invited to, because people just like to try it. So it's a fun conversation starter, and it's a great excuse to drink beer. My mom's a physical therapist, and most of my desire to be in medicine comes from her. I used to actually go and visit some of her patients that she gave therapy in the home with her when I was younger. But when I went into med school, I thought I'd be a primary care doctor just because I wanted that personal one-on-one relationship with people where I followed them as they got older. But urology and surgery just kind of struck me as a way to see some immediate results in helping patients. And so yeah, I made that decision after being exposed to all the different fields in medical school. There is a huge variety of things that I do, from kidney stones to kidney cancer, to pediatric urology, to female urology, to male urology. And so on any given week, my schedule looks different from a standpoint of what type of patient I'm seeing, but it also looks different from a standpoint of what type of surgery I'm doing. And so the variety keeps it interesting. I think also, pretty much about 40% of the time I'm in surgery every week, but 60% of the time I'm meeting with patients in clinic. So there's a good balance there. And then I just really enjoy that most of the disease processes we treat in urology, they're very treatable, curable things. So somebody comes in with a problem, we have the tools to fix it, we fix it, they get better, they go about their lives. And so some of that immediate gratification was also a big draw. We are one of the only urologic departments in this town where all of the urologists do robotic surgery. And so it's been a great home. It's been a great place to corroborate with other physicians, whether it be primary care physicians or physicians in other specialties. It's been a great place to be highly reputable in the community. It's also been a great place to be a doctor. So the clinic worries about most of the other stuff, and I just get to practice medicine. So that's been a benefit to me. It frees me up to have more time to concentrate and communicate with patients.